Good morning. This is Dr. Amrith, Professor of Pathology. So today's class is on viral hepatitis. As usual, I would just like to say that we have started with the GIT, gastrointestinal tract pathology, and this now we are following the diseases of the liver, and this is the first class on liver pathology. So it's best that we speak on viral hepatitis before we go further towards jaundice, the symptoms of various acute and chronic hepatitis, and then followed by tumors. So you should know what is viral hepatitis, what are the different types of organisms which causes the viral hepatitis. You should know that viral hepatitis is a systemic disease with inflammation of the liver. Now the viruses which resides inside the liver are known as hepatotropic viruses, and the most common are hepatitis A, B, C, D and E. So not only these, but we have the other virus infections like herpes simplex, CMV, EB virus and yellow fever, which causes almost similar but not the same symptoms. But the most common of them are mostly hepatitis A, B, C, D and E infections. Before we go further into each and every infection, I would like you to know that how do we define hepatitis, how do you define acute viral hepatitis, and what is acute fulminant failure. So hepatitis is the inflammation of the liver, and then viral hepatitis, how do you differentiate between acute and chronic? This is what I keep telling in my every class. Acute means less than 6 months, and if the disease is more than 6 months, we call it as a chronic hepatitis. So in the acute hepatic failure, it is basically the jaundice which appears, and there is the acute loss of the liver cells which happens. 80 to 90% of the liver cells get lost, and you will have all the derangement of the liver functions, but the disease subsides within 8 weeks. So this is known as acute hepatic failure. But if you see that the liver injury has led to the fibrosis or the scar tissue, and of course there's a gradual inflammation which persists more than 6 months, you can call it as fulminant hepatitis, and also the cirrhosis which happens later on. Alright, so you have to differentiate between acute and chronic hepatitis with the failure which is associated along with it. The next slide deals with the types of viral hepatitis. It's a very brief view, and this table will help you to learn and memorize the different aspects of the viruses easily. So as you know, the hepatitis A and E are spread by fecal-oral route, while B, C, D are always by IV transfusion, which is known as parenteral transfusion, and which can happen in the hemophilics, in the multiple transfused patients like thalassemia and hemophilia. So this is the IV route. Then we have the transmission from the mother to the child, vertical transmission, and also the sexually transmitted in hepatitis B virus. Now most of them can happen at any age. There has been no specific criteria, but hepatitis C is mostly IV among the drug users, so you can say hepatitis C is commonly seen in adults, because usually you don't see children getting abused with the drugs. Now the carrier state is more common in hepatitis B, which is very popular, and the people usually transmit the infection to the others without showing any symptoms of the infection. While it's also seen in hepatitis C and D if it is only associated with the B. Now in the hepatitis D, we have to deal with two things: what is co-infection and superinfection, which I will be dealing in hepatitis D virus in detail. The incubation period, as you can see, A, D and E usually is between 2 weeks, so 10 to 14 days, and B and C will show a longer incubation period, more than a month. And the chronic infection can be seen in B, C and D, and the prophylaxis or the vaccination is available for B, okay, and sometimes it is also available in A, but it is not being commonly used for hepatitis A nowadays. So let's get into the detail. Hepatitis A infection. It is the most common infection that is present in the developing countries. The symptoms just appear and disappear. Sometimes the patient do not come to know that he is suffering from hepatitis A. But the most common symptoms are fever, chills, headache, fatigue, weakness, aches and pains, anorexia, nausea, vomiting, and jaundice. So as we know, the incubation period 2 weeks, mode of transmission fecal-oral route, and mostly all these people on the sidewalks for all those smart food, these are the people who are usually carrying this infection. So the diagnosis is based on the demonstration of the virus in the feces or in the blood, or also you can show the presence of antibody inside the blood by the ELISA method, and also the derangement of the liver function tests like ALT, bilirubin and protein that are mostly elevated, and RT-PCR is also something which we can use to detect the virus. So in the next figure you can see now IgM comes in the blood first. This we all know. We have finished the immunity chapter, and we know that IgM is the first antibody which appears in the blood after any infection. Now when the IgM goes down, the IgG, which persists in the blood throughout their lives just to make sure that the patient had a previous infection. So this is the antibody which tells you that the IgG, the patient has been infected with hepatitis A virus. So, and other levels like transaminases and everything, they are always present or elevated in the blood. So how do you prevent it? By the passive immunization or by active immunization, but mostly it is not a severe condition. So the basic you can say proper diet and proper hygiene is most effective. So let's go to hepatitis B. Hepatitis B is it is a severe infection, so it can be transmitted through the parenteral route, sexually transmitted, and even vertical infection, as we have discussed. So in this, it will cause inflammation, jaundice, rarely death, but it definitely causes cirrhosis and liver cancer, which is why the vaccination is so important in the developing countries. This is the virus, which is the molecular structure of virus. You can see. Okay, we'll go to the lower picture, which is known as a Dane particle. This is to show the different types of antigens which is available on the virus. And also to add on to this, you should know that HPV is a double-stranded virus, SS. Okay, while all the other viruses A, C, D and E are all RNA viruses. Okay, so we have a surface antigen, which is the first one to appear in the blood. Then we have core antigen, and then we have HBe antigen, which are commonly seen in the circulation after the infection. So this diagram usually tells you about the presence of different antigens inside the virus. You can see. And also this is also known as a Dane particle, and this name was first proposed in Australia by an Australian scientist when he discovered this structure, and he was actually given a Nobel Prize for that. So it's you should go back to that history and you should know more about the Dane particle, but this picture shows you the presence of different antigens. Now the infection depends upon three factors: age, high risk group, and humoral and cellular response. Now 90% of the patients, they resolve, and very rarely they go to the fulminant hepatic failure if proper treatment is given, but few of them may get into a chronic state. While it also depends upon how the patients are, whether they are drug abusers, or they are having multiple transfusions, or they are in contact with the patients who are sick, and also if they have multiple sexual partners, or if the patient is HIV and having other immunocompromised immunity. And the third one is the response depends upon three antigens I have told you before: HBs, HBc, which is another core antigen, HBe is the envelope antigen. So HBs, I told you, it's an Australian antigen, so you need to get back and follow the history of this antigen. So incubation period, as I told you, it's a more than a month, usually maybe 2 months as well. Mode of transmission we have discussed, and the diagnosis is very classical. So you can have a viral HPV DNA testing, RT-PCR testing, or a liver biopsy, or even the liver function test will tell you about it, about the derangement of the liver functions. So before I go to this chart on the next page, I'd like you to know that